are the 6 safe and effective behavior management strategies. 1. Be mindful of your own reaction. A vital component of managing difficult behavior is knowing that your behavior affects the behavior of others. What you say or do in response to an individual behavior affects whether the behavior escalates or stops. When you're aware of this factor and when you're equipped and empowered with other effective and respectful behavior management strategies, you're better able to de-escalate difficult behavior and help individuals regain control and make possible choices. 2. Maintain rational detachment. For your rational detachment, you maintain control by not taking negative comments or action personally. Without this capability, team members may react instinctively or defensively, which will only escalate a situation. Equipped with this skill, you're better able to diffuse challenges, behavior, and encourage positive behavior. Be attentive. When people feel ignored, marginalized, or not cared for, they often act what? An effective way to counter a person's anxiety is to validate her feelings. Pay attention to what she says, give her plenty of personal space, show her through your facial expression and body language that you are listening, and you can take away her reasons for being upset and give her a reason to regain control. 4. Use positive self talk. Remind yourself that when you're the target of an outburst of a negative situation, you're really the cause of the behavior. And just as thinking, I can't deal with this, might cause you to react one way, telling yourself, I know what to do, will cause a more productive response. 5. Recognize your limits. Being a professional doesn't mean that you can't handle everything, knowing that you have support and backup in crucial to staying in control of your own behavior and response to appreciate. Accept your limits and keep in mind that sometimes the best decision is to let someone else take over. 6. Debrief. Be sure to debrief after an incident. Talking about it can help relieve their stress. It's also important to consider what we've done well and how to respond better the next time or situation occurs. A person who have deaf blindness has a greater or lesser extent of hearing and vision loss. This result is difficulties accessing information. Person with deaf blindness use different communication methods. Person with deaf blindness may be accompanied by an intervener, a professional who is trained in tactile sign language. This sign language involves touching the hand of the client using a two-handed manual alphabet, also known as a finger spelling. Other persons with deaf blindness may use American Sign Language (ASL) or Language des Signes Québécois (LSQ), or they may require small window interpreting, signing within a restricted range of vision. Some persons with deaf blindness have sight or hearing, and others have neither. Persons with deaf blindness will probably let you know how to communicate with them if you are unsure. Ask. Strategies for one-on-one with a student with deaf blindness. Patience, respect, and a willingness to find a way to communicate are your best tools. When you are approach a person with deaf blindness, identify yourself and speak directly to them. Ask permission before touching the individual unless it is emergency. A service animal may accompany a person with a visual disability. Service animals are working and should not be distracted. Speak directly to the person, not to the intervener. If you are not sure what to do, ask, can I help? There are many types of physical disabilities, including mobility-related disabilities, health and medical disabilities, and disabilities that result from brain injuries. Sometimes disabilities are obvious. However, it is not always possible to identify someone with a physical disabilities or medical or health-related disabilities. Some physical disabilities require the use of an assistive device, for example, a wheelchair or walker. However, those with arthritis or multiple sclerosis, for instance, may not show any visible signs of disabilities. Physical disabilities may affect someone's abilities to start, walk, sit, or move around. Some physical disabilities are episodic. They can flare up and then go through periods of remission. Some person with physical disabilities may be accompanied by a personal support person. Strategies when you are one-on-one with physical disability. Remove obstacles and arrange furnitures to ensure clear pathways to where you will sit and conduct any meeting. Consider an ascensive device as an extension of the person's personal space. Remember, the most powerful wheelchairs are controlled by a handheld device and should be left for the individual to control. Is a conversation expected to last longer than a few moments? Suggest an area nearby that is comfortable for all parties to be seated. Speak directly to the person, not to an accompany support person. If you are not sure what to do, ask, "Can I help?"